One of the things that, certainly through investigation and conversation with our urologist, the issue of being able to have children after prostate cancer certainly was an issue. I was 49 years old. I have a grown daughter, and we had a little girl who, as I said, just turned 1 March 2006. But we wanted to expand our family. My wife was actually pregnant when I was diagnosed with prostate cancer, but we still knew that we'd like to have more children. But of course, once you go through prostate cancer surgery, that certainly limits your opportunities to have more children. So one of the things we did take advantage of was in vitro fertilization and the in vitro clinic in our area. So we decided to investigate how that would work and what the procedure would be. So prior to March of 2006, we went to the in vitro clinic and did everything we needed to do to make it possible to have children down the road, which actually proved to be a very good thing and a good plan for us, because, as I mentioned, my wife was pregnant, and the day that I had my prostate cancer surgery in March of 2006, I remember she came into the recovery room and she was very sad. And I said, no, I'm fine. They're telling me that, I woke up, and waking up is a good thing. And she said, unfortunately, I have some bad news. She said I had just had an ultrasound and she had had a miscarriage. So if we hadn't done what we did prior to my surgery, that would have been it. I mean, we would have been fine with that, but it's something, as I said, going back to that checklist, it's almost something that needs to be on that checklist to say, hey, have you thought about this and this and this and this? Because there are so many things bombarding you at that point in time that it's absolutely impossible to think that you can have all of the questions and all of the answers. So, we went through the in vitro fertilization procedure. It actually worked the very first time. And my wife gave birth to another little girl who will turn 6 in a couple of weeks. And when she was born, my wife said, is it a little boy or is it a little girl? And I looked at her and I said, we have our amazing Grace. And that's where Grace Hennessey had her start. So again, it's something that I think that it's not for everyone, but I think people need to understand that is an option and something that, they should put somewhere on their list of things to think about.
Some prostate cancers are high risk, aggressive, and more likely to spread. Others are low risk, least likely to have bad outcomes. The biopsy says cancer, but current diagnostic tools provide limited information about how aggressive a man's individual disease is. So most men decide to treat prostate cancer immediately. Once treated, many men experience serious long-term side effects, like incontinence and sexual impotence. Immediate treatment isn't always needed, but right now a man can't be sure if his cancer is the kind that is likely to require treatment, or if he's okay to wait for now. What if there was a test that could determine how aggressive prostate cancer is? Genomic Health is developing a new test to do just that. By reviewing the underlying biology of the tumor and using genes from multiple biologic pathways, the test can predict the aggressiveness of prostate cancer when diagnosed, allowing a man to make a more informed treatment decision with confidence, taking care of himself with more information and greater peace of mind.